Hi, I'm Dr. Ed Jacobs, and I'm going to be playing a role with Dr. Tori Stone. She's going to be an impact therapy counselor. And what we're trying to show is a multisensory approach to counseling. Impact therapy is a theory driven approach and it's multisensory. And we wanted to give you a chance to see some of it in action. So the benefit of the role play is you'll mainly focus on her and the techniques that she uses, because you'll see that she talks to my eyes as well as to my ears. And if you want more information about impact therapy, go to impacttherapy.com. So I'm going to be a 15-year-old boy that's got a lot of anger issues at school.
Okay.
Well, did Mr. Smith tell you why he wanted me to come? Did he tell you about me getting in that trouble in the lunchroom?
He told me you had a little fight.
Yeah. Well, it was a pushing. But I just get mad, and I don't want people into my business. And I don't know. I think that's how I am. And if somebody is going to be butting in line, I'm not going to take it. And my dad's told me to always stand up for myself.
I remember you told me that last month when you told Mr. Smith to F off.
Yeah. Well, yeah.
Something we didn't talk. Do you have that? Oh, here. Something I don't know. Did we talk about this last time? Did I?
No.
Oh. Something that occurred to me last time when that happened with Mr. Smith, and I know we talked a little bit about your fuse. Do you remember that? I talked about you having a short fuse. When something happens, this is a bottle of Coke. What happens when I shake this up? Feel it. I should have let you feel it before, but feel how there's what's in there that's making it.
It's bubbling up.
Yeah, it bubbles up, and what would we call that? If you just shook and shook and shook and shook, what do we call that? The bottle will get harder if I kept shaking it. What do we call that?
What?
The bubbles push out, and it creates, what do you call that? Pressure?
Yeah. Oh, yeah. Okay.
Yeah, and I feel like that's kind of what happens with you. So if I asked you to open this right now, open it over there. I'll go stand over there. You open it. Do you want to do that? Open it and just hold it over your shirt and.
Oh, aiming at me?
Yeah.
Oh no, not.
Why? Because what'll happen?
It'll spew all over me.
It'll spew all over you, and that's what I feel like happened in the cafeteria. Can I have that back? I won't open it on you.
Okay.
You get shook up, Ed, and then you spew over everybody around. In the cafeteria last month with Mr. Smith, last year, remember the situation?
I just think I have a short fuse, I think, right?
We talked about that, but we talked about the fact that you believe you have a short fuse, but we also talked about what you can do to lengthen your fuse. And I think we need to talk some more about that today. This bottle is shook up. Is it always going to stay shook up like this?
No, it'll calm back down in 10 minutes. 10 minutes I would open.
Yeah, and that happens to you too, right? You get shook, but then eventually you're calmer. You don't live your whole life like this, do you?
No.
Okay, so you can exist flat. Do you got a bottle of water in here?
I don't think I do.
Okay, well, you can exist. Imagine this was a bottle of water. Flat, no bubbles, right? You do live your life like that.
If I shook up a bottle of water?
What would happen?
Well, I would open that.
It wouldn't explode.
Why is that?
Because it's flat. There's no pressure, no carbonation in there. Right now, you're flat. I'm flat. So there's no danger of either one of us exploding all over the place.
But I know you're not going to step in line. You're not going to do anything to hurt me or bother me.
That's true. But there's some things, remember last time we talked about things you tell yourself when you're in those situations that get you shook up. And you said something to me earlier. Hold that for me. You said, they should, and should is a dangerous word. We're going to talk about that. Not cut in line. And if they do, you're not really saying this, but this is what's happening that's shaking you up. If they do, I can't stand it. And I'm going to get them.
Right. Okay. Okay, we're going to stop on. let me just quickly review this. What Dr. Stone did was she used a multisensory approach, the Coke bottle, that engaged me, engaged my brain, and I think this kid, as the client, I'll remember the Coke bottle. And she also used theory, and she used the whiteboard. That's what impact therapy is. It's a multisensory approach. It's an active approach and a multisensory approach that gets the client thinking, and that's what you, in this short clip, you saw that that's what Dr. Stone was doing. And she would then go on using REBT as a major theoretical approach and try to help this boy have some control over his anger.
And I am a school counselor. I get lots of kids who come to me because they've been kicked out of someplace because they're shook up. Or sometimes they come in and they are shook up. So teaching them how to calm down, act rationally, think rationally, and avoid that happening in the future. I could not be as effective as a school counselor without multisensory, theory-driven approaches, and impact therapy is the one that has helped me to become the kind of school counselor who can make changes happen with kids.